There's a difference between the thought, I have cancer, versus the thought, my health anxiety had just informed me that I have cancer. Health anxiety often pulls us into the game where we feel like we are in the experience. And that's what we're trying to do with our health anxiety. We're trying to see it as maybe not the most reliable of informants. And so when we think about cognitive diffusion skills, we're thinking about ways that we can be able to shift our relationship with a certain thought. Today, we are going to talk about a tool that you can use that is based in what we call cognitive diffusion. Now, before we get started with this skill, one of the things that I want to make sure that we go over is why we use this tool. A tool like this is not to be used to make us feel all better, to get a wonderful answer that makes us feel so good. Unfortunately not, because we do know that those answers are elusive. And so when we think about cognitive diffusion skills, we're thinking about ways that we can be able to shift our relationship with a certain thought. Now, this is not about trying to get away from a certain thought. It's not by trying to dissociate from ourselves from a certain thought. It is really about trying to shift our relationship so then that way it feels a bit different and a bit different to work with. So this cognitive diffusion strategy isn't an attempt to get us to argue with our brain or to try to figure out if something is right or wrong with us. We're trying to use it as a skill to be able to go from a place where we feel like we have to do a health anxiety ritual to maybe then we have some options to be able to do something else. So when we use a cognitive diffusion strategy, one of the ones that we're going to talk about today and we can practice together is we're going to use the prompt of health anxiety told me. So let me give you an example that sometimes I like to use with people. Using cognitive diffusion strategy is like going to your favorite sporting event, whatever that might be. I like hockey. When you're at a sporting event, if you were on the, what we call glass seats in hockey, or if you were right on the field, or if you were courtside, whatever it may be, you are doing two things. One, you are seeing the game happen, but you're also in the action. I mean, you are right there and you are just feel immersed into the play. Now, if you had a section up in the nosebleeds, you could still see the game, hopefully, mostly. However, you're going to be pretty disconnected from that experience. You're not going to feel like the players are right there. When we think about cognitive diffusion, health anxiety often pulls us into the game where we feel like we are in the experience. And one of the things that makes it hard to be able to do is to not feel overwhelmed by the experience and then to give into health anxiety rituals. So we want to be able to take ourselves up to the nosebleed seats so we can still see the game happening, but we can approach it a bit more intentional. So when we think about this idea of health anxiety told me, it is different. That's a nosebleed seats type of mentality. It's different than a statement such as, I have cancer. When you think of a statement like, I have cancer, it is right there. We are in the action. Now, one of the things that we can do to rephrase this is maybe even rephrasing this statement of, my health anxiety just told me that I have cancer. Now, we're still talking about the exact same phrasing. We're talking about the same thing, right? Cancer. But how we say it, the relationship that we have with it, is now a little bit different. Because there's a difference between the thought, I have cancer, versus the thought, my health anxiety had just informed me that I have cancer. Let's use another one. We could have a courtside seats, an immersed thought like, there's something wrong with me. And when we reframe that to, my health anxiety has just told me that there's something wrong with me. Still talking about the same content of there's something being wrong with us, but the thing that we're doing is we're actually changing our relationship with it. Even when you think about some of those things for yourself, And I'm going to drop a worksheet along with this that starts to help you in one column be able to identify what are some of the person-centered thoughts, like I have cancer, there's something wrong with me, etc., etc. And then on the other side, there's going to be a little table. I want you to start to list out, if we were going to rephrase those of, oh, actually, this is my health anxiety telling me that I have cancer. This is my health anxiety telling me that there's something wrong. Now, what we're not going to do, just like we said earlier in the video, is argue with our brain. That's not the point of cognitive diffusion. It's not to be able to try to get an answer about this, but it is going to be able to start to give us an option about if it feels like it's a person-centered. We're right there. It's going to feel like Googling, checking our body is going to feel like I absolutely have to do that. If we frame it in this idea that, oh, health anxiety had just told me this thing, it's kind of like if you hear some gossip from someone and you're like, hey, did you hear that this person, blah, 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 right? And at first you might be like, oh, really? You gotta be kidding me. But the one question that's always important to be able to say is, where'd you hear that? Now, if they say somebody that's really trustworthy, maybe we believe them a little bit more. But if they say somebody that often is known for stretching the truth, we just might not be as convinced that maybe that's actually happened. And that's what we're trying to do with our health anxiety. We're trying to see it as maybe not the most reliable of informants. So I'm going to upload a document, a PDF with this video that gives you a chart. We will talk to you soon, continuing practicing living with fear, not in fear, and then we'll talk with you next time.